Hello, hello.
Hello, everyone.
What's going on, man? How are you?
Hey, I'm good. Here we are live. Here we are live to the world.
We're gonna adjust our screen a little bit.
I can move back a little bit. Ben and I are getting some low lighting in here.
We're
Some low lighting.
How is everybody? We're getting some people in here. Hello, hello. I see Roel's in here. D-Len.
Yes.
What's going on?
Come on, bring it on. We're ready for a good one today.
Dude, I always enjoy the live shows, like the ones right
Yeah.
next to you. Like this is cool.
I couldn't imagine a better place to be at 7 o'clock than right here next to you,
Right next to me.
answering these questions. I love it.
I see Tom's in here. Tom, you did amazing at your meet this past week, man. I'm proud of you. That's incredible. I got your email earlier today. Carter, thank you. Thank you for being here. Happy
Do you want to
Tuesday
make
to
the
you.
announcement?
I got engaged this past weekend.
Ben got engaged.
I did.
Ben got engaged
I did.
to the beautiful Amanda Murr.
We're
We're excited to welcome her into the family.
Huge shout out to Amanda, my new fiance.
It only took her a few seconds to say yes. No hesitation.
And it was just there. I mean,
It
she
was
said
just
yes.
there.
She said yes.
It was
That's
just
all.
there. She
That's all we need to
said
know.
Yes. Okay. Say yes to the dress.
All
We
right.
are excited to bring another female into the family.
All right, let's see who's in here. Oh, thank you guys. Thank you guys. Y'all are the best. We're going to take questions all night tonight. We only had one question come in throughout the week, so we'll get through that. Thank you, Lisa. I love you.
Ooh, get those congratulations in there. If you're
let's see.
happy that Ben is getting married.
Michelle in here. Hello.
Yes.
Ron. What's going on, everybody? We're excited about tonight. Thank you, Lisa.
Shared and congratulations. This is amazing.
Anybody new tonight? Do we have any new faces? If so, where are you at? Also, let us know if you're in harm's way in Florida. I know we have a lot of Florida people on the show, so let us know how you're doing. I believe there are. Let's see here. I'm getting a little.
I saw that too.
From Mom, tell Andy not to swivel in chair. It makes her dizzy.
Mom, we got medications for that, okay? I'm going to throw you a little scopolamine patch over there, okay? I got a swivel.
Just no swiveling tonight. I mean, we went through this in our pre-planning.
No swiveling? My knees are nowhere near this. My knees are nowhere near this table, ladies and gentlemen. I'm going to try to stay as still as possible because I'm swiveling. No, that is true. Mom, that's great. She knows. She knows what's up. She knows. Mom's always looking out for us. She always wants us to be like, looking good. But sometimes I get
we get passionate about this.
I get the jimmies.
You know what I'm passionate about? I'm passionate about Edna because Edna came in last week, said she got some PRP the week before from Jill. So Edna, we want to know how you're doing. I believe it was in the knee, the shoulder, maybe.
I think the knee.
Was it the knee? Yeah, I think you're going up to Jill.
I'm going up to Jill next week to get it done in my shoulder, and I can't friggin' wait. It's going to be amazing.
Katie's saying your face looks awesome.
Katie knows the secret.
The tallow.
Katie gave me the secret. The tallow.
The aloe tallow.
I am the aloe tallow. I am on the beef tallow train, as Katie is the conductor on the beef tallow train. And I am now a passenger, and I'm loving it. So thank you, Katie's so sweet.
Thank you, Katie. Thank you for being here. Thank you, Carter. You guys are amazing. If y'all have questions tonight around
throw them in.
Anything that Andy's doing personally, I know he's. We went through his vitamin list last time.
It was long.
That's kind of fun. Dad's going to do a show about all the different things he's doing.
I think that's great.
I think that'll be
everyone
really interesting.
Block out about 3 hours because it's a lot. People do ask all the time. It's like, what is your dad doing? I always say, a lot.
And keep with it. And it takes a little bit of time. I think Dad mentioned that last week. What did he say? Like it takes 4 to 5 weeks before we start to feel
at least, and sometimes repeat.
Okay.
And sometimes repeat.
Yes.
And just do it the natural way, which I really, really like, Edna.
I see Grandma Mary's in here. I love you, Grandma.
Kiki.
Thank you so much. And she's writing her own story, and I just love every part of that.
I know.
I love every part of that.
She emailed me today. We're working on it, and we're going to put Kiki's story in a book form.
I love it.
Yeah.
I love it, Grandma. We love you.
Available to you at the nearest Barnes & Noble.
I love it. All right, guys, we're taking questions. We'll be taking questions till 8 o'clock tonight. Like I said earlier, we only got one that came in throughout the week. Also, I apologize if our screen's moving a little bit. I'm trying to, trying to get the questions up without causing some stirs.
Maybe I wasn't swiveling.
Maybe it was me.
Maybe it was you.
Maybe it was me. And you got
Maybe it's Maybelline.
Guys, thank y'all for hanging out. If y'all have questions for Andy, go ahead and put them in the comments. I see Lynn K. Lynn is in here. Lynn K. Lynn, what's up?
Ho, ho.
Okay. We've got a berberine question.
Berberine.
That came
God
in
love the bee.
Doc had suggested I take berberine for matters other than weight loss. I would like to know what type and suggested brand of berberine to take and what dosage, milligrams, timing, frequency. So not for weight loss.
So berberine can be very anti-inflammatory and actually can help with cholesterol. So I guess it depends on what he was specifically telling you to do it for. But anytime you're decreasing insulin or insulin resistance, you're going to decrease inflammation. So I think at least I kind of would approach it the same way. I don't think you necessarily need to max it out. Technically with weight loss, you want to go with higher doses. I think in general for vitamins, and if you just want to write these down, we technically have a recommended vitamin sheet in every one of our offices. We can email it to you as well. That's for the patient type, age, and condition that you're looking for a natural standpoint. And then at the top of that sheet, it says really great brands. So really great brands, of course, our brand is amazing. We get it formulated by Freedom to formulate, and they're just amazing to work with. So the sourcing is really, really good, and the dosages are really good, and dosages that you'd want to take. Other brands are Life Extension, Now, Solray, Thorne, Pure encapsulations. Those are all really good. So those are ones to check out as well. I would trust any of those brands. As far as suggested brands and type, dihydro or regular berberine is fine. I think sticking with regular berberine, unless I would probably go for dihydro if you're looking for weight loss, and regular berberine if not. Dosage 400 milligrams to start, and then work your way up if tolerated and you see noticeable changes for what you're looking at it for. I'd say be on it for 1 to 2 months, retest whatever lab if there's a data with it, or take almost like a snapshot of self-assessment of how you feel, and then go up from there or continue at the same dose.
Out of curiosity, it's they've called berberine nature's Ozempic. So obvious for weight loss. What other things are you seeing people take berberine for?
Insulin resistance and cholesterol.
Okay. Interesting.
Insulin resistance and cholesterol. Helping out with bad or fluffy LDL cholesterol. But a lot of it's getting rid of inflammation. Berberine's been around forever. It's great.
Such a great question. Real quick, I'm going to put this up here for you guys. One, because this is a common question we get on the show. It's around blood pressure. I'd encourage everybody to listen to this, watch it wherever you listen and watch podcasts. Dr. Rogers gives a great synopsis of how he looks at blood pressure, talks a little bit about what you can do at home for this, supplements, when to be concerned, when maybe not to be so concerned. So super important episode.
Under pressure.
I love it. And real quick, I'm going to put this up from the start of the show, Robin Riddle.
Oh, Robin.
This episode of Explain This is on IUDs, the risks and benefits. Super important episode for anybody thinking about birth control, anybody who has been on an IUD or wants to get on one. Share this with your friends, share this with your family. What's so interesting, every time that I get to talk with Robin, about stuff like this, there's so much conversation that doesn't happen with like when you're in a typical office visit.
For sure.
And a lot of the stuff that she describes around IUDs, around birth control, doesn't get talked about when you're deciding what to do.
Robin we're so lucky to have Robin. She's an amazing provider, also very, very passionate about functional fertility. She has a functional fertility program within performance medicine that she's written. It's amazing.
Yeah.
And then looking at anything it's interesting to note too, birth control is also used for other things too. So like abnormal bleeds, menorrhagia. So you're having really heavy, painful periods. Sometimes people will go on a birth control to help alleviate that. There's just different ways to go about it. The IUD episode is great. Yeah, everyone needs to check it out.
Super, super important.
We were playing it in the North Knoxville office this morning.
Yeah, no kidding.
I kid you not. Ben, I wouldn't be more surprised if I woke up with my head sewn to the carpet.
I see McLeod Organics. Jonesboro's in the house.
Jay,
We love you.
oh,
We love you. And
God.
I see the great question there. I see
I miss
Montana's in here.
seeing you
Montana, we love you.
too.
Okay, we're gonna keep moving here. We got questions already coming in. I see Roel's been here for a minute. We're gonna get to that in just a minute. If you guys have questions for Andy, put them in the comments. We're gonna get to every single one tonight.
Yes.
Let's start with Roel.
Roel.
My mother's homocysteine levels.
I didn't get to finish.
Okay.
Roel. I'm begging for you, please don't take my man. That's a riff on, I don't know if everyone knows the song Jolene.
Jolene, that's Dolly.
By Dolly Parton.
That's Dolly. That's
Yes,
Dolly.
I'm never going to be invited back on this again.
We're working on our timing right here, guys.
We're working on timing.
But no, that was nice.
This is like, is it Elvis and Costello?
I think Elvis Costello is a person.
Oh,
Is it Elvis and Costello?
it's something in Costello.
Oh, really?
Abbott and Costello.
Abbott and Costello.
Abbott and Costello. Who's on first? What's on fifth? Yeah. Okay. Anyway, Roel.
Roel's question.
Next question.
Here we
I'm
go.
just kidding. I'm just kidding.
All right. My mother's homocysteine levels were high, and she was put on a supplement called Zaquil XR. But this supplement is for depression. Any thoughts on this? I bought her the Life Extension B complex.
So I don't know Zaquil XR. That doesn't come to mind. I believe it has to deal with B vitamins. So I need to look that one up specifically. But I think Zaquil XR deals with particularly methylfolate. And if methylfolate is low or B vitamins are low, it can be associated with low mood or depression. So I think that would be almost like not an indication for depression, but a byproduct of having low vitamin status. So I think Zaquil XR, most likely I will look it up before we leave today, but I think it's methylfolate being low, and then increasing that can then suppress homocysteine. A lot of this deals within the methionine pathway and where certain things get blocked. So it's homocysteine also deals with MTHFR, just like B vitamins, homocysteine, MTHFR all play around with each other. So if there's a positive MTHFR mutation or genetic malformation, that can mess with your homocysteine levels and your B vitamins. So sometimes those all play together. So I would say too, probably a good thing. I would want to look up the exact quantities. If it's a supplement, we're not looking at something that's like serotonergic for depression, or deals with norepinephrine, which is probably a good thing. But I'd say watch that, especially if it's natural. Watch the homocysteine levels. That might be another great thing to use. And I believe it's dealing with B vitamins, which would only be great for depression and for homocysteine levels. Life Extension B complex is amazing. It is methylated, so methyl B complex will just have all the B's in it as well, and maybe Zaquil XR just deals with methylfolate. So I think either or, B vitamins are water soluble. You'll pee out the rest that you don't need. So I think that's a good thing. Yeah, go for it and recheck a homocysteine, and then let me know. We could use that.
Roel, thank you so much for that.
That's a great question.
Is there ever a scenario where you wouldn't want to use the methyl B vitamins versus just regular B vitamins?
If you don't have a methylation issue, you don't really need methyl B vitamins.
So it just doesn't matter.
It just doesn't matter as much. Most people go for a methyl anyways. If you have the MTHFR mutation, it's very hard to absorb B vitamins that are hydroxycobalamin, almost like different prefixes or attachments.
Yeah. Would you judge me if I told you I don't think I've checked the MTHFR.
You've not checked at Cleveland?
I've checked at Cleveland, but
it should be on your Cleveland.
Well, then it's been a couple years.
That won't change. I'm just saying, if it's on there, it's on there.
I don't think I have it.
Ben,
but I don't know.
I was going to say Ben doesn't like to participate in some of the stuff that we recommend, including the talks, when it's readily available for Ben.
There's actually a video of you giving me Botox.
I'll never forget the day. I'll never forget the day.
We
lit a candle.
We did
light a candle for.
It was actually around. I feel like it was.
It probably was around Halloween.
I think it was too.
Yeah.
Okay, Roel, thank you so much.
That's a great question.
We're gonna keep
check the
moving
homocysteine in response to it. Let me know.
Thank you. Okay, good with the family, Roel. Thank you. Lynn K. Lynn, is there any truth to what I've read about long-term use
Ooh.
causes kidney damage of the GLP-1s? So I'm assuming, Lynn K., long-term use of like the Ozempics, the semaglutides. I've read that it can help kidney health too, which is correct. What's your thoughts? I'm interested.
Lynn K, Lynn K, Lynn K, Lynn K. Every time. I would do it every time. So two, this is interesting. I would say, is there any truth? I'd say there is one truth, and I'll kind of explain that mechanism. Is there long-term kidney damage, or is there some sort of reports out there that says, hey, it causes long-term kidney damage, like the commercials you'd see for mesothelioma, or did you have a vaginal mesh in? There's nothing out there within any of that class of incretin hormones right now. In fact, the only thing that are coming out is just better and better news with all these compounds. Improved brain health, improved cardiovascular benefits. Kidney health hasn't been out there, but I think it will be, that it actually will help. So the mechanism is also, it's kind of like berberine. It's decreasing insulin resistance, improving glycemic index, and decreasing inflammation. I've seen reports where Ozempic helps out with psoriatic arthritis and joint pain goes away. Rashes go away. So I think there's going to be actually a lot more that we discover that's beneficial rather than detrimental over the long term. However, kidney damage can happen if you do not stay hydrated. So I think a lot of it is that you would probably be reading long-term causes of kidney damage if you're having decreased hunger and decreased thirst. Because sometimes that happens, well, that does happen. You have a decreased appetite with GLP-1s. I've actually had patients tell me it's hard for them to drink water and keep it down. So I would say too, if you're not being able to stay hydrated with GLP-1s, then it could cause kidney damage because you're not putting anything through the kidneys. If anything that I've seen more that's probably worse, or like if it's not treated really, really quickly, can turn poor, or really poorly very quickly, would be gastroparesis. Too much slowing of the gastrointestinal tract, because that's a primary intention of GLP-1s, is that it can slow food going through the gastrointestinal tract, causing gastroparesis, causing bowel obstructions. So I would say that's more immediate. Long term, I'd say that's a very secondary, tertiary consequence of not having enough water. And I have had that. I've had people say, I can't drink water on this. So you got to lower the dose. You got to find a dose that works. Some people do anything at the cost to get a weight that they want. And a lot of it is that you have to say, everyone should see our nutritionist, Lucas, our nutrition coach. He's amazing. You got to eat to lose weight too. And you got to drink water to lose weight. It's not just don't eat anymore and you'll lose weight.
Yeah, it does sound, just talking with you and Dr. Rogers and all of our providers, like there is a lot of strategy with it, and you do want to find that right dose, so you don't feel nauseous, you don't feel terrible,
and it doesn't have that negative side effect. Like two, if you're already prone to constipation, and two, if you're already prone to dehydration and you don't drink that much water, it's gonna negatively affect you. So I'd say too, making sure you're staying hydrated with this. Technically, I was talking to a patient yesterday about this. Technically, you're supposed to drink half your body weight in water as a minimum, and then you should try to do your body weight in ounces in water, not your weight in water,
right.
in ounces.
Right.
Remember, we're 1/3 water. We're basically 2/3, 3/4. Jeez, oh my god, 3/4, like 75% water.
You know what we need?
I was eventually going to get there.
We need to have like, I want a segment of this show to be like, hey, here's where we missed the mark. Like,
fact check.
In fact, Andy, it's 78%.
Yes. Oh God, no! Don't do that. Please don't. No. I can't handle it.
No.
Ben has to read all the negative comments. I can't read the negative comments. I can't do it.
Do you feel better? Like, you've been drinking a lot of water lately. Do you actually feel better? Like, can you notice?
I do. Yes, I do. And sometimes too, with type 1 diabetes, it kind of makes you go to the bathroom more anyway. So sometimes water does help out. Water technically helps out with hyperglycemia, high glucose. I was lecturing on type 1 the other day in DKA, diabetic ketoacidosis, in the treatment algorithm that you would do in the hospital or ER setting. You're doing water, you're doing fluids. So you got to get a ton of fluids, and fluids will bring down your blood sugar. So yes, so it brings down your blood sugar. It nourishes everything. if you don't drink enough water, your organs are going to find a way. You protect the trunk first, so everything else that's exterior gets it last.
This might be a dumb question, but for those that are on a GLP-1 and plan on staying on it for the long term, is there labs they should be watching out for? Is there any
That's a good
markers?
question. It's technically not required. So if anything that you're doing, if you're looking at medications, it's also interesting to look at the product insert, which technically comes in every single box that you get for any drug. The product insert is in there. Indications, usage, and it gets really science and technical, but it's really amazing. I think it's interesting to see what's in there. All the studies are in there. So you have all that at your fingertips if you're ever curious. It comes in the box, or you can Google it. So with certain medications, there's things that you have to have certain labs for. If you're on a biologic, you have to check for liver enzymes. If you're on lithium, you have to check for vitamin D. If you're on, the list goes on. There's certain things that you have to check a mark to make sure that are okay. There's not one for this particular medication, but I do think it's really great to check a metabolic panel for your liver, kidney, and electrolytes. I think that's kind of where it would fester. And two, if you're interested in what your A1C is doing, you can check A1C, which is a 3-month study of glucose, more related to diabetes or pre-diabetes diagnoses. Or even looking at like an intact insulin or C-peptide. That's how active your insulin resistance is, or if you're insulin sensitive.
One other thing I know Robin's talked a lot about is just making sure that your muscle mass isn't decreasing. So make sure your protein intake.
That's great. Yes. Doing some body impedance scoring. We have a machine in West Knoxville and a machine in Johnson City.
Yes,
Johnson City. I'm there. I know. That checks your muscle content, fat content, bone content, and water content. So kind of doing an impedance score that way to make sure that you're not losing muscle with it, because there can be some muscle loss.
Great question, Lynn Kaylin. If you guys have questions around the GLP-1s, there's no better person to ask than this guy. So put them in the comments.
And if you have any questions about where you're going to get your next sweater before the circus runs out of town, this is your guy.
Yeah. I'll do that.
Where's my Mary Kay's been? Where's my Mary Kay's?
Well, where's Edna's lip flip?
Edna, oh my sweet Edna, I will give you that lip flip. I will flip that lip. Okay.
I love that.
Edna, I'm so sorry. I should be in Johnson City soon, and I will flip that lip like I've never flipped a lip before.
I love it, Edna. Thank you so much.
Your lip will flip. I'll flip over your lip flip.
I want to know this actually. How is your lifting going?
Tom, thank you so much for asking. Poorly. I'm just kidding. It's not great.
You're doing a lot of,
but I'm doing some body lift. I'm just not doing a ton of. I've got some kettlebells going. I have some sandbags that have been donated to the cause, which I just call me.
Yeah.
We
the cause.
The cause.
You
donating to the cause, which is me. Andy, GoFundMe Andy LLC.
I make deposits every day.
GoFund Andy LLC. Limited liability company. No, but I have joined a gym.
Crunch is coming.
Yeah,
Crunch Fitness.
We've kind of got a partnership where they're going to do some local advertising for businesses around this area, and so I will be lifting there. Tom, you will not be able to recognize me. I'll be so big, I won't be able to fit on the screen.
I love it, Tom.
But not great yet. Thank you, though, Tom. Thank you for checking in on me. You're keeping me accountable.
All right, McLeod Organics, Jonesboro.
I miss y'all too. I can't even talk about it. I can't. Next question. I can't talk about it. I'll get emotional.
He can't even do it.
Oh, JBO.
Okay, so this is a 1 aspirin per day for prevention, 81 milligrams or whole aspirin. So this is around the dosage for prevention.
81.
Yeah.
81 baby aspirin, not a whole aspirin. Whole aspirin, you're looking at actually like significant clot history, heart attack. Even with heart attacks, you can say with baby aspirin, but baby aspirin, that's what you're looking at for preventative, and also looking at preventative for colon cancers too.
When you turn 40, are you going to take one?
Okay, can I tell you that I already did?
Really?
I know, but I took it away. I know. Sometimes you have to experiment, and the best person to experiment on is yourself. And so I got a little bit too much like bruising.
Really?
Yeah.
Interesting.
I was doing it because I traveled to Europe this summer. I was like, I'm just, having type 1, it already makes you prone to clots and arterial damage and endothelial damage because, there's hyperglycemia within the arteries. So I was like, arteries, whatever. So I was like, I'm just going to protect it and start it and do it for the trip. But man, when I'm telling you, I would bleed and I kind of got a heaviness. I'm actually going to a vein person. I am.
Really?
I'm going to a vein person. It will be a mystery. We will solve this together. But I had an injury to my ankle about 12 years ago. I shouldn't swivel. Sorry, Mom. I was swiveling. 12 years ago, I had an injury to my ankle. I ran over it in a golf cart.
I remember.
Do you remember? I remember it well. And I didn't do anything about it because I was young. So then I worked on it all summer. I haven't had it looked at yet. And there's some pooling in the blood there. There's a little bit of almost like it looks like my veins are working against some of that because I think there's some vascular damage. I'm having a vein specialist look at it in Johnson City. I can't wait.
Will you keep
Prevention.
Yeah.
I'm not super symptomatic now. There's two things actually going on with my health where it's not super symptomatic, but I am getting it checked out and I'm trying to do something before it becomes symptomatic.
Yeah.
One is my rotator cuff in my shoulder. It's like I can still do stuff, but I feel it. So Jill's going to work on that with PRP. And then like they took an x-ray of my mouth at the dentist. I love the dentist, Martin Dentistry.
Yeah, they're the best.
I have a membership.
Yeah.
I belong there. I love them. They found that there was a shadowing within one of the roots, which they'd never seen on my mouth before. And a little bit, almost like it's almost like you get a shadow within the root and underneath the tooth. And he's surprised. He's like, has there been damage to the tooth? And I mean, it was sitting there. I could see it plain as day. So I'm going to go to an endodontist.
Interesting.
Sturgill endodontist. I'm excited to see them. Can't wait to see you. Check out this mouth. Tooth 27.
I love it.
But two, I don't have any symptoms. So it's not like I'm going to wait until this tooth hurts to get it pulled. I'm going to look and see, okay, what's really causing this?
Yeah. That's interesting, man. You're all about prevention.
I'm all about prevention. Ben?
I see Rachel.
All about
Can I say
prevention.
just huge shout out to Rachel.
What?
Rachel, we love you back.
Oh, Rachel.
Thank you so much.
Oh, Rachel's growing a baby right now.
I love it.
She's growing that baby.
I'm excited.
We're having some PM babies and she is super excited. We're excited. I'm excited. We call each other Barbie. Barbie.
Let's get to Lisa. Lisa, thank you for sharing the broadcast as always. It has been 3 weeks since my foot injury, big toe broken in 3 places, third toe broken, pinky toe broken, fractures across the top of the foot. There's no change in the swelling at all. When can I expect some improvement in this foot injury? You know what's interesting is when I think of, there's not a lot of blood flow going to
it takes a long time.
So it's just like a really injury that just doesn't heal quickly.
God, I almost wish Brittany was on this right now. So one of our providers came from podiatry for 10 years, and she would absolutely know this question, or perhaps Jill too with orthopedic injury. I'd say too, it takes longer than that. I would say anything, probably 6 to 8 weeks, especially too, because it depends on what they've told you about weight bearing or non-weight bearing. Are you in a chair? Are you in a scooter? Are you putting pressure on it? Did they put plates in it? Did they put, not plates, but pins in the toes? Are they just letting it sit there? It'd probably depend on what they actually did to your foot. Some swelling is good. Some swelling is healing. That just means a lot of stuff is coming to protect. I think a lot of swelling is for protection, unless it's a side effect of a medication or congestive heart failure. This is probably because, especially with injury or orthopedic injury, it's to protect that area. It's like, I was like, hey, stop, don't do anything more. Don't touch this. I need some healing factors in there. So I think some swelling is good. The swelling will go down. I'd be careful about what kind of weight bearing you put on it. And two, making sure your immunity is top notch. I wouldn't worry about swelling if I'd give it at least another 3 weeks of being swollen, and ask them too about movement and PT, because I've seen some injuries to where if you don't move it, you'll get a frozen joint basically. So if you, it's almost like that since the foot's furthest down from you, that's going to have the most opportunity to swell because that's where all the fluid's going. So I'm curious to know what they say about what your elevation looks like. Are you supposed to keep it elevated? I'd follow their instructions pretty strictly. Does that make sense? I would say 3 weeks after a crush injury like that, no, I'm not surprised.
In a boot. Okay.
Don't kick anybody in that boot. Okay.
That would hurt.
I bet it's too cute to boot. I'm so sorry. I should make that. Lisa, I hate that you're experiencing that. I hate that you're experiencing that. But two, with the boot and see what they say and what their recommendations are for elevation. Should you get it up so that some of the, you can see, get it up so that some of the swelling can come down, and what type of movement you want to do to keep some sort of mobility within the toes.
Lisa, keep us posted with how you're doing. Because that's a long recovery. We'll be here with you every step of the way. I see Robbie's in there. Robbie, what's going on, man?
Robbie,
so good to see you. Let's get Tom here along the line with what Lisa's talking about. I was told I had a broken hand years ago when a lat pull tipped over and mashed it. Never saw orthopedist as suggested. What does Andy say about that? That's tough. I don't know. What's your thoughts?
Shoot, if it's
maybe it's okay.
If it's not bothering you, yeah, I said don't worry about it. It'd be interesting to see what your X-ray looks like, to see if you had a broken hand, to see where that break was and what that fracture healing looks like. To see, because you can see healed fractures on X-ray, and it depends on how many years ago it was. But if it's not bothering you and you're keeping full range of motion and mobility, I think it's fine. Sometimes old injuries can come back to haunt you later on, but really, I mean, if you're looking at what an orthopedist is going to do, it's how do you move with the joint or how do you fix the joint? So I feel like if it's a healed fracture, they want to go ahead and re-break and put it back together, especially with the hand where there's so many different bones in it. So I say when it hurts you, I say if it's not hurting you right now, don't say anything. But if you're interested in what it looks like, I'd be more interested in that.
And it says 3 years ago, full range of motion.
Yeah,
okay, cool.
Totally fine. But you can get an X-ray just to see what it looks like.
Thank you, Tom,
That's a good question.
that comment and question.
You're a badass.
I'm going to put this
I
up
love it.
also from Tom. It's around the methyl. That's interesting. Had a bad experience with the methyl versions taking folinic acid / hydroxycobalamin.
Sure. I think that's great. Listen to what your body says.
Thank you, Tom, for that.
And check levels in response to it.
DPC, what's going on? Great to see you. Is it okay to take the baby aspirin every other day to reduce the excessive bruising?
Totally. Totally. Yeah, I think that's totally fine. Better in than out if you're using it preventatively and you're of the right age for it. So better in than out. And two, less can sometimes be more if you're having a side effect from it. Two, another thing to kind of combat bruising is arnica or arnicare. That's a natural component that helps out actually with coagulation. It's not going to make you hypercoagulable, but it can kind of keep blood in the right places. So arnica or arnicare are great things to maybe combat it if you wanted to do like a baby aspirin every day, but every other day, yes.
It's interesting.
Yes, and this too depends on like what you're using it for. Because sometimes if you're coming out of a heart attack, no. Right. You need something and you need something different. Even like Xarelto, Brilinta, something that's a little bit different for anticoagulation. If you're using it preventatively, yes, I'd say that's fine. And two, remember that we survived a long time without these. Yeah. The human race has survived a long time, and they got creative in the way. I mean, too, they probably died a lot quicker than we did today. But I mean, when we do stuff preventatively, it's like we're trying to do it as optimal as possible. But I wouldn't say it'd make a difference especially if you're having bruising and it changed it to where you did it every other day and you didn't have bruising. I think the benefits outweigh the risk of that. That's a good question because that gets specific. I like that.
Yeah, any specific questions like that's what we're here for. So thank you, DPC, for that. Let's get to Carol here. Have you heard of or treated anyone with de Quervain's tenosynovitis?
Rudo? How about Buzz? We're quoting Billy Madison. I love that movie.
I didn't know that was Billy Madison.
Rudo? The dog.
Of course, man. Andy's gonna make fun of my pronunciation here, but I did miss that. How would you pronounce it?
Kidding. I mispronounce stuff all the time. I'll tell you, to this day, I've always said semaglutide, semaglutide, and semaglutide. I don't know. People say
how do you say phentermine?
Not phentermine.
You don't
I say
think
phentermine.
Phentermine.
Instead of phentermine. There's also too tinnitus or tinnitus. Everybody put in there if you think it's tinnitus like tennis or tinnitus like itis.
Guys, put in
I
there,
think it's
what do you think?
tinnitus
I'd say tinnitus.
because it's inflammation.
So this would be-
tinnitus.
So this would be
But tinnitus, I don't know. I've said both, and I say it both every time. I was like, ringing in the air, tinnitus or tinnitus. I say both of them. But this is de Quervain's tenosynovitis.
Okay.
So it's inflammation of the tendon in the synovial fluid. I believe it's this. I believe it's right there. That's if you know you have de Quervain's. It's right there. So it's this particular portion of your hand, and you can get it injected. Yes, Jill would be able to do that. So too, absolutely you can. There was some sort of association that this is a post-pregnancy thing, or like after like a postpartum, not post-pregnancy, but a postpartum thing, you can get de Quervain's tenosynovitis. I think that's it. And two, you would need some sort of anti-inflammatory for it. It's usually a steroid.
Let's see here. I hope that helps, Carol.
Yeah.
Let us know if we need more context. I'm going to go to Instagram real quick. Michaelia, I see you. Hope I'm pronouncing that okay. And thank you, Michaelia. Had success with treatment using braces postpartum. Okay, super cool.
Wait, say that again.
So Michaelia is saying, I wish I could put this up for you guys, but I can't move it from Instagram. I had success with treatment using braces postpartum. So I'm assuming that has to do with the tenosynovitis.
Oh, okay. Yes, okay.
Does
So
that
it
make
is a
sense?
postpartum thing. Yes, and two, you put it into, you can get like hand braces for it. Yeah. Oh, cool.
Thank you,
cool.
Michaela.
Well, I hate you had to deal with that, but still, really cool.
Let's see. Let's get to your question here. Maybe it's Brooke. I hope I'm not botching your name here. Do you have any advice? Do you have any advice on treatment of geographic tongue? It popped up for me mid-pregnancy, and I'm now postpartum over 2 years and still experiencing it.
Shoot, yes. For geographic tongue, there's a lot of different ones. I don't know the naturals for it. I know that sometimes they'll use like a magic mouthwash if it's thrush related. Off the top of my head, I do not know anything other than magic mouthwash, which technically has some lidocaine in it. I would have to look that one up too, because there's something too about different tongues and how they look like strawberry tongue, which I believe is thrush, or maybe strawberry tongue. If it looks like pitted strawberry, it's maybe that's a shoot. These are all like test questions. Like scarlet fever, something like that. I think there's some sort of fever associated with strawberry tongue. Geographic tongue is something different. It might be too, I would do anything that's not abrasive on it. Maybe even trying L-lysine that helps out with a lot of canker sores. That may help out with geographic tongue. Magic mouthwash kind of just gets rid of all of it. I need to look that one up. I'll look that one up specifically.
Brooke, what we'll do is we'll make a note of that, and one,
or if anybody else knows,
if anyone in the comments knows, let us know what your thoughts are. But Brooke, we'll put this down here, so we have a little reminder here. We'll get that to next week, if not later on today. Geographic tongue
for like natural stuff. I think magic, anything that's kind of in the mouth that you don't know, magic mouthwash. It's usually a compounded, not from a compounding pharmacy, but every Walgreens, CVS can even make it, and they all have their own formula. And it's to decrease the sensitivity, decrease pain, get rid of yeast on your tongue and some of the like bacteria that has overgrowth. So that tends to help, but geographic tongue might have a specific deficiency associated with it. That replacement may help. But my answer right now is L-lysine or magic mouthwash. And avoiding salt.
Brooke, thank you for saying that. So you've seen Brooke before in the JC office with Graves. Okay.
Yeah.
Okay.
Yes.
Okay. Thank you for that.
Come back and hang out.
Come back and hang out.
I remember that. We don't get to see Graves quite a bit. So yeah, I totally remember that. I hope you're feeling better. I really do.
Thank you for putting in that question, Brooke. I'm going to put this up one because I love Dr. Riggins. Had the same thing in my left hand, finally got fixed by Dr. Patrick Riggins, and never another problem until the ace is back.
That is awesome.
Yeah.
Dr. Riggins worked on my elbow. I love Dr. Riggins.
He's the best. Okay, let's go. I'm going to put this up for Brooke as well. No postpartum. Okay, I've had one injection, which lasted only 5 weeks. Wear a brace sometimes during the day, noise at night. Doing a shot wave treatment at my chiro, but not really sure it is helping. From groups I followed, most end up surgery to relieve, trying to avoid surgery. I'm with you.
It's almost like a carpal tunnel release sometimes with surgery to kind of help release that. Shoot, I'm sorry. Yeah, so you're doing all the right stuff. So I would give it time, maybe even adding in as much natural anti-inflammatories as you can. High dose curcumin. It's another one. Curcumin. I say both. Going up to like 1,000 milligrams. I mean, like a lot, or even like higher than that. I think that 1,000 is considered high. In Dr. Rogers' pain formula, there's 500 of turmeric, I believe, which are very similar. So doing some of the high natural anti-inflammatories, and even to looking at diet. I swear, sometimes diet can really make a difference in some of the aches and pains that you're experiencing. Even checking out your thyroid too. Even too, when we're just talking about that, we're just saying with Graves and postpartum de Quervain's tenosynovitis, checking out your thyroid.
That's interesting.
There's some interesting stuff with like pain and joint pain and thyroid dysfunction. So maybe ruling out thyroid is another one I'd try, or some of the naturals to help relieve some of the inflammation.
Super interesting. Carol, thank you for that comment and giving us some, oh, nice. You're taking the pain formula now. Okay.
Good.
I hope
Good.
that's helping a little bit. Let's get to Ginger here. I just had COVID for the first time. It took a week to get past the fever, chilling, and aching. The cough is still lingering on which was expected. Does having COVID put your system at a long-term disadvantage, or can you bounce back quickly?
I think first up, congratulations on like being the last of the Mohicans. I mean, COVID is a long time ago, so good for you that you just had this. You avoided it for a very long time. A week of symptoms isn't bad. A lot of people ends up being about 5 to 7 days. Yeah, having it in your system. Can I go back to the question, Ben? Sorry. Okay. Just having COVID in your system put you at long-term disadvantage, or can you bounce back quickly? Some people bounce back quickly, never even know they had it. Some people does give them long-term disadvantage by having a long haulers type syndrome. Usually ends up with symptoms lasting for over 3 months. I would say take all the stuff for it, like take ivermectin, do your breathing treatments. Cough is still lingering on more than expected. I would get on breathing treatments, cut the inflammation before it has a chance to hang on. Do nebulized budesonide. I would be doing all the naturals for it in the high doses for the next couple weeks. Vitamin D, 50,000 IUs. Vitamin C, 2,000 milligrams with quercetin, zinc 50, maybe even twice that. I would do all those things in addition to nebulized budesonide, ivermectin. If you're out of the fever phase, maybe holding on Z-Pak, and out of the chilling and aches, then I would definitely do ivermectin. I'd maybe even do a full course of ivermectin. It's 0.4 milligrams per kilogram, usually anywhere from like 30 to 40 milligrams once a day for 5 to 10 days. I would do that. If it were me, I had COVID in 2020 as part of the OG. I'd do it heavy right off the bat. Whether or not you're symptomatic or not, and just don't give it a chance to build up that inflammation.
Ginger, I hope that helps a little bit.
But long-term disadvantage is over 3 months of crazy symptoms. I'm sorry. I hope you bounce back quickly. If you're a week out, that's still quick.
I hope you start to feel better.
It took me a long time.
Yeah.
About a month of feeling like winded going upstairs.
Yeah.
Yeah.
I'm going to go real quick for Carol on Facebook. I see Brooke is saying, I went through 2 shots and they only work short term. You truly have to brace it regularly to see a difference, at least.
Good. Okay, that's good to know. So maybe
for
bracing regularly to kind of decrease that inflammatory response right near the thumb and wrist.
All right. Thank you, Ginger. Thank you so much. I see Dr. Creech is in here. Dr. Creech, you're the best.
Yes.
That episode on fluoride was incredible. I've literally listened to that like 3 times in the past couple of weeks. So thank you so much for doing that. I want to put this up from Rowell. Joe Rogan had 2 guests speak on the broken healthcare system. Really good information. Thank you for putting this up. I actually, after last week's show, we watched a little bit of the one with Buhler, I believe, Buhler, I think, and super interesting just around the healthcare industry as a whole. And so thank you, Rowell. We're definitely following that.
Buhler.
Guys, I don't know if I.
Come on, Ben. Come on, Ben's in the zone over here trying to crack a joke. Come on. Ferris Bueller's Day Out? Anyone? No?
Come
Just
on.
me? Ben wasn't from the 80s like me.
What do you think? I'm from the 70s?
Ben was more of a 70s kid.
If you guys have a question for Andy, I think we've gotten to all of them so far. If I missed you, ping it towards the end so I see it. I want to make sure I don't miss anybody tonight. I see Keisha's in here. Keisha, what's going on? Great to
Yes.
see you.
Oh, yes.
So
We
good.
got some fun people on tonight, y'all.
This is the best.
Oh, Keisha.
This is the best.
Oh, Keisha.
Roel's already given us a 10. This is
Come
incredible.
on, Roel, it's a 10. Baby.
He is my brother.
And I love him like myself. Ben and I learned a song called He's My Brother and I Love Him Like Myself.
Let me just warn the audience
Ben's
here.
an amazing singer. Do not let him fool you.
If you guys don't come up with a question, we're going to be singing, and that's that could be.
Yeah, I used to make Ben harmonize. I used to make my roommate Will in PA school harmonize in the car. Like, find my pitch. This is my pitch, and it's your pitch, Ben. Find it. This is it. This is it. Find it.
Find
Hang
it.
on to it. Don't move.
I won't
Don't
move.
move.
I
I'm
won't
gonna
move.
move here.
I
I'm
won't
gonna move
move.
here.
Y'all getting an inside look at what our life is like. This is what we do.
That's what we do. We find. I know Mom is laughing. We
I hope-
find our pitch.
D-Lynn, I'm sorry. I hope we get some questions, or else.
We do the third above the third.
Carter, I don't know yet. Carter's asking a great question.
Oh, that was good. Ben really can sing. He can sing.
Keisha's saying we should do questions around type 1. This is correct.
Hey, we'd love it.
Yeah.
What are we would love to answer that, wouldn't we?
Yeah.
Just have a type 1 show. Keisha, be me and you, okay?
Hey, you're speaking at TAPA.
I am.
So tell us a little bit about that. What is TAPA?
Yes.
What are you talking about?
So I'm going to the Tennessee PA Association. That is TAPA. Every state has their own PA association. And they have conferences every year. So I'm going to their Fall Fest. It's their big conference up in Gatlinburg, and I am a speaker.
That's awesome, man.
And I'm excited. Thank you.
Proud
So
of you.
I'm speaking on integrative health. So a lot of people and providers and practitioners don't know really what it is, and it kind of gets muddled into. Everyone has their own spin on it. Integrative, holistic, functional. So I'm going over definitions of that, and then how to approach the patient from a traditional practitioner standpoint who is an integrative patient, and then typically what we do in some case studies. So they'll be familiar with LDN, familiar with compounders, dispelling a few myths about hormones, even though there are a couple lectures that are talking about testosterone and updates on women's health. So I'm interested to see what they do.
That's really
I'll be
cool.
up in Gatlinburg.
That's
I'm
really
excited.
cool, man. I'm excited for you. It's going to be incredible. If any providers in here, let us know. Let's go. I see Carter.
Oh, I know too. Yes, and I already Carter. I got him to. He's going to have an invite in there. That's in.
What-
come on.
What is it? A UW? Oh, Up with People. Up with People. Yes. Is
I'm an
is
uppie.
Carolyn Up with
I'm
People
an uppie. We're uppies.
alumni? I love it.
Up with people, you meet them wherever you go. I do. I was cast A09. Oh man, swing claps.
Honestly, I love that show. I went to
I
the
loved
one,
the Up
went
with
to the
People
one
show.
in Orlando.
You did.
I did. I loved
You
it.
did. That was a fun experience. That was a fun experience.
How long was it?
For all you uppies up there, well, ours is just
Is it Uppies? Like you?
uppies,
Uppies.
like guppies, but no G. Uppies. We only did it for about 6 months. We did it for 6 months. A
Is
lot of
it-
the programs used to be a year long, but ours is 6 months.
Okay. That's
Mhm.
awesome.
It was
That's
so
cool.
fun.
Carol,
One
thank
of the
you.
best experiences I've had. Up with people. You
All right.
I love it.
Real quick, if we don't get a question here, we'll call it a night. I want to put this up for Katie. Where is it at? We are running a special. If you guys are interested in the
Yes.
Dr. Ryder Stress Relief or the Immune Complex, they are $10 off on the website, I believe, and in office too. So definitely check that out if
They
you
are.
have not. All of our vitamins are on performancemedicine.net.
Everyone is stressed. Okay. Everyone's stressed. Everyone's immune system's low. We all need it.
Let's see
Ben's
here.
hanging on by a thread. Okay.
Let's get to Lisa here. Thank you, Lisa. I have a friend with COVID and it's coughing pretty bad. What can she take that will help with the coughing? So coughing around. So with
Ooh,
with
yeah,
COVID.
yeah,
That's a great
Lisa.
question.
Yeah. So too, I really think the nebulized budesonide is the best. That's an inhaled steroid through a nebulizer, which means it goes deeper, it diffuses deeper into the lungs. So that really helps calm the inflammation that's stimulating cough. Other things that you can do for cough. There is Tessalon Pearls. It's not got a great success rate. It either really works for you or doesn't work for you. So Tessalon Pearls are 200 milligrams. You can take them up to 3 times a day, I believe. 100 milligrams or 200 milligrams up to 600 milligrams daily. And then another one too is like if it's really bad and they just need to calm it down so there could be some healing, then people will do like Tussinex,
Yep.
Or codeine, Tylenol with codeine, some like heavy hitter cough syrups. This can have some addictive properties to it. So if you can do other versions of that, I would, with COVID and coughing, I'd go prescription. I would totally do prescription for that. And I think the inhaled nebulized budesonide is the best.
Lisa, I hope that helps.
That's a great, yeah, it's great.
Yeah, I'm gonna put this
Tell
up
them to see us. I mean, yeah.
For Carter here. Yeah,
Yes.
like with the weather in Florida, we will.
on.
Let's prayers up, so that you guys can get out
Y'all
there.
are gonna have an amazing
You'll
time.
have an amazing time.
You already have beautiful tan skin. It'll be even more beautiful and more tan.
I hope it's the best. And I'm praying for everybody in Florida right now. I know it's like there's a lot of is it Milton? Milton's the one that's coming through right now, the hurricane.
Yes.
So prayers out to everybody in Tampa and anyone that's in that path.
Yes.
All right, we are going to call it a show, I believe.
This is a great show. Everyone, y'all.
Yeah, this is the best.
This is the best.
Like, dude, and
You're the
I
best.
appreciate you doing this with me in person. I love this. Like, this is so much
Me
fun.
too. What if I did it across the hallway?
That'd be interesting. I was like,
Wave over on the other side of the hallway.
no, this is so much fun for me,
This
man.
is great.
I really
This is
appreciate
great.
you coming out.
I appreciate you too.
Guys, how did we do?
This is great.
Let us know in the comments
Yes.
how the show was. We do this every single week, 7 to 8 on
Yes.
Tuesdays. We answer your health and wellness questions. We appreciate you guys hanging out with us every week. Like Tom. Tom's here every single week. Roel, D-Lynn. You guys are the best. I see ADW on Instagram gave us a 10. Thank you.
Y'all,
that means a
thank
lot
you.
to us.
Thank you.
We love doing this. We'll be back next week as always. Angie, what's going on? Great to see you.
Angie,
Yes.
I will text you back.
Yes.
Angie, I will text you back.
I will make
because I
him
am
text
just
you
as
back.
excited. I'm just as excited. I will text you back.
Thank you, Lisa. Thank you, Stan. Thank you, Carol. Thank you, D-Lynn. Yes, absolutely. Prayers up for everybody down in Florida. Cherry, thank you. Michelle, thank you. Michelle, thank you so
10
much.
plus, thank you. Y'all,
This is the best.
this is the best.
Do we get a
brother.
comment on our mics? This is our Jackson 5 mics.
Stop, you better save it.
Thank you, D-Lynn. Thank you, Dylan. I appreciate. I hope you guys enjoyed this, and man, if we can, provide any
Yes.
sort of relief of any way, that's what we're here for. We
That's
love
what we're
doing
here
this.
for.
So thank you, man. Thank
Yeah.
you for real.
Hey, too, for those in the Knoxville area, I will be in a show. I've been doing shows at the Jonesboro Theater for a long time.
JRT shout
And
out.
I'm back at the Oak Ridge Playhouse doing Cinderella, and I can't wait. It's
And
going to be fun.
I'm
It's going
so
to be a
pumped.
great show, and it's stacked, y'all. It's
It's
a good cast. Oh, it's a good cast.
Oak Ridge Playhouse. Can I recommend?
Oh,
one
recommend.
I would recommend take a Digest Shield, then go to Big Ed's,
and then go to Big Ed's,
and then go to the show.
and then go to the show. And you can go to that Raspberries place.
Oh,
Mom used to
Raspberries,
do
so
that
good.
Daily Grind. So yeah,
so good.
get a drink before.
When's the run date?
It's going to be Black Friday, so it's going to be
November?
Friday after Thanksgiving through the 15th. Please go. Oak Ridge is such a gym, just like Jonesboro is such a gym.
Yeah.
Oak Ridge is such a gym. Their artistic director Reggie is
the best.
good. Y'all, this is gonna be good.
It's so interesting to me, like the areas that we spend the most time in with the Tri-Cities and Oak Ridge, Knoxville. The quality of local theater here is incredible.
It's amazing.
Allison, I see
Support
you.
local.
I love you, Allison. So good to see you in here. Thank you so much as always. That show,
That's a show.
dude.
It's a
We
wrap.
did it, man. We
did it.
We did it. Guys, we love you. We'll be back. If you guys didn't catch, this is my brother,
Good night
and I love him like myself.
and good luck.
All right, guys, we're out of here. Let me end the podcast. Check out the podcast on all platforms, Performance Medicine TV. All right, we're out of here. Let me see if I can find my Sarah. Sarah's in here. Sarah, what's going on?
What? Oh my God.
So
Don't
good
play
to
with
see
me. Don't play with me. Come on, don't do that right at the end. Don't play with me. Don't do it.
Oh, and will you send Carter your days?
Yes, I will. I have a lot more days to send you too, Carter. I have some 2025 days to send you.
We
You
are
just wait.
Where's my outro? Brad, where are you at, man? We love you guys. We love you. We'll be back Tuesday, 7 to 8. My outro.
Don't go.